Hi viewers, welcome to our channel. Presently, we are with Dr. Karthik Pandurang Jadhav and he is MBBS, MD, General Medicine, DM Cardiology. Hi sir, how are you?
Hello, Ishwar.
Sir, smoking and drinking effects on heart attack.
Yes. So, smoking, as we know, tobacco has got almost 2000 chemicals in them, out of which there are at least 200 to 300 chemicals which are dangerous for the heart. In that, the nicotine, which is the most common chemical in the tobacco, once it is smoked, it will cause the blood vessels to become smaller in size whenever we smoke, and also it will increase the speed at which blocks are formed. Okay, so these blocks, once we are born without any blocks, but as the age progresses, for any person, small blocks will happen, like 1% block, 5% block, 10% block, like that. But if we start smoking, these blocks will become very common. And not only heart, blood supply to the brain, blood supply to the hands, legs, all of them, they start getting newer blocks, and with those blocks, newer problems can start. Like for example, if brain vessels, they get blocked, you can get a stroke or hemiplegia, paralysis. Whereas if we get blocks in the heart, of course, as I said, heart attack can happen. And if blocks develop in the legs, vessels of the legs or hand, then you can end up with a gangrene, wherein you can have to cut your hand or leg also. So that's why smoking is extremely dangerous. Okay, so of course, there are other things about smoking, that is, it can lead to cancer. That is, of course, another thing. But then coming to alcohol, so alcohol contains a chemical called ethanol. Ethanol, when we have ethanol in very high amounts, so first it will damage the liver. Okay, and liver is the main organ where it will produce proteins which are required for our immunity and also for clearing our cholesterol. So in a way, it is affecting our cholesterol levels in the body by reducing the protein levels. That is one. Two, alcohol has got direct effect on heart also. If one particular level is crossed and if we have lot of alcohol, then that will damage the heart by increasing the size of the heart. That is one. Two, it can give rise to some conditions wherein the heart rate can go up to 200 and 300. The normal heart rate is 60 to 80. But in such conditions where alcohol is, we have alcohol at a very regular intervals and that too in a large quantity, in such patients, patients will end up with a heart rate of 200 and 300. They are known as arrhythmias. And these are very dangerous. Patient can suddenly die because of arrhythmias.
Sir, what are the precautions to be taken after bypass surgery?
Okay, so as I told about stenting, so if there are any blocks in the heart, okay, if there are multiple blocks and we cannot put stent everywhere, and putting multiple stents is also dangerous. Why? Because if we have blood vessels covered everything with the steel or whatever metal, then again another block can happen, and that is quite dangerous because while doing procedure, they can end up with a bleeding also. So in such conditions, we do procedures something called as bypass. Like for example, if there is a road congestion is there, okay, so you're not able to clear the road, what will happen? You have to create one more road which bypasses that point A to point B, and you end up with a newer road, but with a different way. So similarly in heart also, what happens is the natural blood vessels, if they are not flowing properly and if we are not able to put stents properly, then we use something called as graft or bypass, wherein we try to put new vessels and we attach it to the end of the artery so that blood should reach the heart. So this is known as bypass. So once bypass is done, okay, usually it takes about 7 to 14 days in the hospital, and once they are discharged, they go back home. We usually tell them to follow 5 things. One, lifestyle changes. Okay, Lifestyle changes in the sense they have to take care that they should not be sedentary in life. So they should not gain weight by being sedentary. Some level of activity has to be there. So this activity includes regular exercises, or including simple things like walking 15 minutes to 20 minutes daily, and continue to be active throughout the day. Should not sit at one place. That is one. Second thing, dietary changes. Changes in the sense we should avoid carbohydrate rich and fat rich food. For example, rice. The rice which we eat commonly in India, or especially in South India, it is white rice, which is the husk of the rice is removed. So that is not a good food actually in that way. It is quite tasty with sambar and all that, but as such, pure white rice is not good because it is very carbohydrate rich. And in turn, this carbohydrate, whatever we eat, gets converted into fat because it has to be stored by the body. That is one. So reduce your rice intake. So third thing is reduce your fatty food intake, like fried items, oily food, especially bakery items have to be avoided as much as possible. Packed items have to be avoided as much as possible. So when I say avoid it, you should not stop altogether, but make sure that you have as little as possible. If somebody is providing you some small amount of chips or something, okay, have one, but that's it. Stop. Don't have more, because you have a problem. You have to deal with the problem. Fourth, very important thing, medicines. Okay. Once a doctor gives you a list of medicines, they should not be stopped unless the doctor says otherwise. And you have to come for the follow-up to the doctor, the same doctor who has operated on you regularly. So once some of these medicines are blood thinners, and some of these medicines, they control cholesterol levels in our body and control the fat levels. So these are extremely important medicines. Now, as I told earlier, the blood vessels will have blocks. Okay. Now, once you have put a stent or once you have put a graft, we have not removed the problem. We have just bypassed the problem. Now we have created some way for the blood to flow, but that is not the permanent solution. The permanent solution lies with the patient himself by changing his lifestyle, the way he eats and the way he does his work. Those things have to be avoided. Fifth important thing, anxiety. Anxiety and tension. A person should not take tension. He should come up with some ideas like yoga and some things like simple aerobics and all that. You have to create some hobbies. You have to create a circle of friends who are quite friendly, or you should have a new pet in your house which will reduce your anxiety levels. So that itself will help you in a long run to avoid a further attack or heart attack in future.